Hello everyone, I am Dr. Rohit Solanki. Today we are going to discuss one very interesting topic, brachial plexus. So brachial plexus introduction, it's a network of the nerves which lies in our neck and axilla. So here this is a cross section at the level of spinal cord at the level of T1. So in the spinal cord, in the dorsal aspect, there are the few sensory fibers which bring the sensation from the upper part of the body to the spinal cord, and there is a one motor fibers or the ventral root in which the motor sensation will brings to the upper part of the body. These both will fuse and form and divide into the two, the dorsal ramus and the ventral ramus. So this ventral ramus will take part in the formation of the brachial plexus. I am repeating it. So there are some sensory fibers, motor fibers, they both will fuse and will form the dorsal ramus and the ventral ramus. So this ventral part of the ramus will help in the formation of the brachial plexus. So these are the network of the nerves lies in the neck and axilla formed by the C5 to the T1 roots of the nerves. So here are the components of the brachial plexus. So first component is the roots. So there are 5 ventral rami C5 to the T1. So C5, C6, C7, C8 and T1. These 5 roots will form the brachial plexus. So C5 and C6 root will merge together and form the superior trunk, while the C7 root will continue as a middle trunk and C8 and T1 will fuse together and form the inferior trunk. So far we have saw that there are 3 trunks: superior trunk, middle trunk and inferior trunk. Superior trunk is formed by the fusion of the C5 and C6, while the inferior trunk by the fusion of C8 and T1, while the middle trunk continues as the C7 root. This trunk will divide into the two, the anterior and posterior, anterior and posterior, anterior and posterior. So these anterior and posterior divisions are called as divisions. So first we have the roots, 5 roots, then we have the 3 trunk, superior, middle and inferior trunk, and these 3 trunk will divide into anterior and posterior. So totally we have the 6 divisions. So we have the roots C5 to T1, trunks, upper, middle and lower, divisions anterior and posterior. Now this division will merge together and form the lateral, posterior and the medial cords. So lateral cord is formed by the anterior division of the superior and the middle trunk, while the posterior cord is formed by the posterior division of the superior, middle and inferior trunk, and medial cord is formed by the continuation of the anterior division of the inferior trunk. So C5 and C6 form the superior trunk, C7 form the middle trunk, C8 and T1 will form the inferior trunk. Posterior fiber of the all the trunk will merge together and form the posterior cord, while the anterior division of the superior and middle trunk will form the lateral cord, while the in medial cord is the continuation of the anterior division of the inferior trunk. Now this cord will give the branches or the nerves we will supply the different parts of the body. So we have the branches from the lateral cord. So in here this diagram we can see that anterior division of the medial, superior and middle will form the lateral cord, and lateral cord have mainly 3 branches. First one is the lateral pectoral nerve, second one is the musculocutaneous nerve, and third one is the lateral root of the medial nerve. So lateral cord give rise to the 3 branches: lateral pectoral, lateral root of median and the musculocutaneous nerve. Now we have the post medial cord. Medial cord is formed by the continuation of the anterior division of the inferior trunk. So this will give branches of the medial pectoral nerve, and next one is the medial cutaneous nerve of arm, medial cutaneous nerve of the forearm, and itself will continue as the ulnar nerve before it will give a branch which is the medial root of the median nerve. So this lateral root of the median nerve and medial root of the medial nerve will merge together and form the medial nerve. So here are the branches of the medial cord are the medial pectoral, medial root of the median nerve, medial cutaneous nerve of forearm, medial cutaneous nerve of the arm, and the ulnar nerve. Now the posterior division of the all the trunk will fuse and form the posterior cord. So posterior cord we have the branches upper subscapular, lower subscapular, and our nerve to the latimus dorsi, and the axillary nerve and itself will continue as the radial nerve. So these are the branches of the our posterior cord. Now we have the some branches from the root itself. So C5, C6 and C7 root will merge together and give rise to the long thoracic nerve. So long thoracic nerve is from the C5, C6 and C7. C5 root will give rise to the our dorsal scapular nerve, and C5 and C6 will give to the nerve to the subclavius. So nerve to the subclavius is given by this C5 and C6, while the dorsal scapular nerve is given by the root C5. So far we have discussed the branches from the root and itself. Now we will take a quick revision. So C5 will give rise to the dorsal scapular nerve. C5, C6 both will give rise to the nerve to subclavius. C5, C6, C7 will give rise to this long thoracic nerve. From the lateral cord, three branches: lateral pectoral nerve, musculocutaneous nerve, and our lateral root of the medial nerve. From the medial cord, there are the five branches: medial pectoral nerve, our medial cutaneous nerve of arm, medial cutaneous nerve of the forearm, ulnar nerve, and the medial root of the median nerve. This will both fuse together and form the median nerve. Now the posterior cord will give rise to the upper subscapular nerve to latimus dorsi, lower subscapular and axillary and the radial nerve. So question is, where is the location or the particular segment or the component of the brachial plexus? So roots, these are the roots. The roots are lying here somewhere in the scalenus triangle. So behind the scalenus anterior and emerge between the scalenus muscles. Trunks will cross over the lower part of the posterior triangle. So superior, medial and inferior trunk will somewhere crossing the posterior triangle, and division will somewhere here, anterior and posterior divisions will be lying behind the clavicle. So somewhat above this part is the supraclavicular, while whatever the below this part is the infraclavicular. So our supraclavicular parts are the roots and the trunks, while the infraclavicular parts are the cords and the branches. Now question is, on the respect of what this cord is got the name medial, lateral and posterior. So it's on basis of the second part of the axillary artery. So our subclavian artery will termed as the axillary artery at the lateral aspect of the first rib. From the lateral aspect of first rib to the outer border of the teres major, it will terms as the axillary artery. Axillary artery divided by three parts with the help of the pectoris minor muscle. This is the first part, which is before pectoris minor. Second part, below pectoris minor. After pectoris minor is the third part. So our brachial plexus cords names are given on the behalf of this second part of the axillary artery. Here we can see that from the C5, C6, C7, C8 and T1, this roots will give rise to the trunk, then divisions, and later on cords are named on behalf of the our second with respect to the second part of the axillary artery. Here we can see that the relation with the first part of the axillary artery. So uppermost is the skin. Below skin there is a platysma muscle, deep fascia and our pectoris major. So this is our first part of the axillary artery. In the first part of the axillary artery, the lateral to it there will be lateral cord, and posterior to the lateral cord will be the posterior cord. So lateral cord, posterior cord, and posterior to this first part of the axillary artery there will be our medial cord. Now we will discuss the second part of the axillary artery. So this is our axillary artery. Above it there is a pectoris major. Below it is the pectoris minor muscle. So below the pectoris minor part of the axillary artery is termed as the second part of the axillary artery, and cord which is lateral to the axillary artery is the lateral cord. Posterior is the posterior cord, and medial one is the medial cord. Now we will discuss the third part of the axillary artery. So this is the third part of the axillary artery line below the pectoris major muscle. Here is not the minor, because below the minor the part of the axillary artery will termed as the second part of the axillary artery. So lateral there will be lateral root of the median nerve and the musculocutaneous nerve. Posterior there will be two. Lateral one is the axillary nerve, while medial one is the radial nerve. In the medial part, anterior one is the medial cutaneous nerve arm, and posterior is the ulnar nerve. This is in relation to the third part of the axillary artery upper part. In the third part of the axillary artery lower part, this will be axillary artery, and this lateral will be the median nerve, posterior will be the radial nerve, while the on the middle aspect there is the ulnar nerve and our median cutaneous nerve of the forearm. So this is our brachial plexus. In quickly we can see that C5, C6, C7, C8 and T1 are the roots. They will give rise to the upper trunk C5 and C6. C7 continues as the middle trunk, and C8 and T1 will form the our lower trunk. They will be divided. The divisions will form the cords. Which one is the lateral cord give rise to the lateral pectoral nerve, musculocutaneous nerve, and our lateral root of the median nerve. Medial cord will give rise to the our medial pectoral nerve, our medial cutaneous nerve of arm, medial cutaneous nerve of forearm, ulnar nerve, and medial root of the median nerve. Posterior division will fuse together and form the posterior cord, will give the upper subscapular, lower subscapular nerve to latimus dorsi, our axillary, and continue itself as the radial